As a parent, there is nothing more heart-wrenching than watching your child struggle with some sort of chronic health issue, despite the fact that you feel like you're doing everything, despite the fact that you feel like you've tried everything under the sun. We hear this from parents all the time. Maybe their kid is struggling with ADHD or anxiety, they're on the autism spectrum, they have a pandas diagnosis or epilepsy, or even just allergies and asthma and chronic immune struggles. We hear that they have been down every single path that they can find, right? They've exhausted the traditional options. They've been on that specialist merry-go-round of being passed from one provider to another. And they've even tried the holistic stuff too, right? All the natural things. They've done diet changes. They've done supplements. They've done detoxes. They've cleaned up their home environment, and yet they're still stuck. This path is so common. We hear it so frequently from families and parents who are into Thrive. And on one hand, I like that there is more readily available information, right? I love that there is way more useful, holistically minded data out there for parents, and they are so frequently getting to that point before they even find Thrive. So that's great. I much prefer those options over the traditional healthcare system. But at the same time, I hate that these kids are still struggling. I hate that they're still missing something, and that's what I want to walk through in this video. When you feel like you've tried everything, when you feel like you've done everything else, what is missing? I want to talk through something that we call this hierarchy of healing, or this pyramid of neurological health, and how there's probably that foundational piece that you're missing. I want to just explain what can you do to get more impact out of the other therapies, out of the other detox and the gut work that you're doing. So let's dig into it. The first thing I need you guys to understand as parents is that it is not just the genes, it is not just the gluten, it is not just the environmental stuff, the gut things that you need to be addressing. It is really about the nervous system. We so frequently are missing that neurological foundational piece, and it's mind-boggling, honestly, because as even just a new baby or maybe even a couple days old, your kids had their eyes checked, their ears, their nose, their throat, their heart, their lungs, and all this stuff, but there is no assessment, there's no conversation surrounding the central nervous system and how that is really the foundation of every single other piece of development. All of these other therapies, all of these other gut work really has to be built upon the foundation of the nervous system. If you skip that piece, you're not going to be able to get anything else out of it. Think of it from a house analogy or a builder. If that foundation is really shaky and struggling and is collapsing, it doesn't matter how fancy the furniture is. It doesn't matter if you put new windows in. They're not going to open. The furniture is going to fall because the floor is sinking down. You're going to have cracks in the walls. You would never put an amazing house on top of a crappy foundation, and that is what we're seeing with so many of our kids. So let me walk you through. You might not be able to see every single word on here, but let me walk you through this hierarchy of healing and where so frequently it goes wrong. Let's start at not the very bottom, but just that second step up. That is honestly where we're seeing a lot of the work being done, and that is on the neuromotor system. Think of PT or OT, those different sensory-based therapies. Those are good things and they're helpful, but that is not the foundation, right? Our motor system, our movement, our muscles, they are moved by neurology, right? And it is specifically the tone, and we're talking about babies, right? Anything from the tension, the arching they're feeling, or toddlers who are toe walking, or some of the sensory seeking behaviors, there's even a tone and a motor concern as well. We're messing with that second step and missing the foundation. Or maybe get to that third tier, the gut and the immune side of it. That is also something we care about. I want you to put proper nutrition into your body. I want you to not be surrounding your environment with medications and negative toxic influences. But at the same time, even if you have the expensive supplements in the whole food organic nutrition, if your body's not processing it well, if you can't bring it in, you're not getting anything out of it. And then especially that very top tier brain-based therapies, maybe primitive reflexes, maybe counseling therapy, those are really a piece of it that I love, I'm supportive of, but we're going to have a much harder time making progress on when that foundational piece is missed. So that foundation, what is it? That is the autonomic nervous system. Think of that as all your behind the scenes functions. At Thrive, you hear us talk about it from this analogy of the gas pedal versus the brake pedal. There's these two different modes that your nervous system operates under. There is your survival mode. That is what we call the gas pedal. That's your sympathetic overdrive, your fight or flight response. That's stress. That is totally okay temporarily. It's okay to temporarily be in fight or flight, but when you get stuck in survival mode, that brake pedal, which is your digestion, your immune system, your growth and development, your relaxation, your sleep, all of those wellness things that we need, that gets shut down and put on the back burner if you're in survival mode. That foundational piece is so frequently what's off. And when you have that foundation that is stuck in stress, well then of course, no matter how much you work at the PT and trying to get the kid's head to rotate better and stretch out the tension so that they're not toe walking, you're never gonna make progress because it's a foundational issue. It is that underlying neurological tension that is creating the tone. And of course, you can't layer on top of a detox program on top of a system that is stuck in survival mode. You're never going to be able to process it. You're never going to be able to bring that food in because their nervous system is so ramped up, they're not able to digest as they should. And then absolutely, if you're trying to work through some of the trauma, some of the therapy, some of the counseling sessions, I love it. You need it in your life. I wish more people would seek that out. But as long as your behind the scenes neurology is in fight or flight, you're not going to get much out of it. So what do we need to do instead? Well, before we get to that part, let me explain one more of where these can go wrong, right? And that's this column here on the side of what are the triggers, the stressors with there. That is a frequent question we get as far as the autonomic nervous system. It's like, well, how can a kid have that's messed up? It can start all the way back in the pregnancy journey, right? So many times in pregnancy, that is a season of life that is a little bit more stressful, right? Maybe there's fertility struggles. Maybe there's some sort of survival mode, fight or flight, gas pedal triggers that mom was experiencing during that season of life. What that does is it primes that baby's neurology for survival mode. And then what often gets added onto that is some sort of in utero stress or some sort of physical birth trauma for that kid. Maybe they were in a breech position. Maybe they had a C-section or a vacuum extraction or some sort of forceps delivery, or honestly, even just doctors and midwives' hands pulling at that really sensitive newborn head and neck. Those factors majorly create this trauma response or this fight or flight mode in that newborn. This very top of the neck, the brainstem area, is extremely sensitive for kids because they don't have the structural stability in their head and neck yet, right? You know a baby has that loose floppy head and they can't really control it yet. You've got to support it when you're picking them up. But that's the area that is most susceptible to damage during the birth process. Where does your brake pedal live? The calming wellness side of your nervous system is right up here. It's a cranial nerve that comes out of the base of your skull, runs right by that first couple cervical vertebrae called the vagus nerve, and that vagus nerve does all of the growth and development functions. Almost all of the gut, the digestion, the immune system function we were just discussing, if that vagus nerve is affected, you're not going to be able to get anything out of it. Or that's probably a little bit too extreme. You're not going to be able to get what you should out of it. You're going to be majorly limited in how your body's able to process and digest food. So, and then of course, the gut and the immune side of it, I think that is the one that Dr. Google or the holistic side of the internet really is hitting hard. We know all about toxins in our environment. We know all about the chemicals in our food and some of the downsides of antibiotic exposure early on. Those factors are massive. They are wrecking our kids' gut and immune system. They absolutely need to be addressed. But once again, they need to be addressed when we have that foundational piece resolved. Everything else, whether it's the PT, OT, speech, the functional medicine, microbiome, detox workout, even the medications, the neuropsych medications you might need, or the counseling, the behavioral-based approaches, those built on a crappy foundation are going to lead to frustration. It's never going to get the impact that you want out of it. So think about this differently, right? Think about not just the symptoms that we're trying to hide, but think about maybe where that foundation of the kid's nervous system got skewed. You address that, it doesn't mean the other pieces aren't still needed. There's kind of two ways you can take that. One is maybe at this point now they're going to be more effective, right? After you've done that healing of the foundation, you're able to layer on top of that better function for your gut, your detox, your immune system as well, and that's going to make a greater impact. Or what we see sometimes too is once you correct that foundation, especially if it's a young enough kid, you don't need the other stuff because their symptoms and their challenges and whatever goals you had are irrelevant at this point because they are crushing it and they are rocking life. Along the way, the cool thing about that journey is you do see little soft signs of that neurological healing, right? We see that healing taking place where maybe sleep starts to happen. Even if you have bigger, more really high level neurologically based goals like seizures, like speech or communication or ADHD and anxiety, there's little things that you see along the way. You see rest and relaxation happen. You see bowel movements improve. You see bloating and GI changes and dysfunction and stress start to melt away. And those are all of our little indicators, or what we call soft signs, that neurological healing is taking place. The foundation is being laid so that we can continue to build on top of it. And the really cool thing that we get to do at Thrive is we've got technology that lets us measure that, right? We have different scans that we do as step one with any patient, is figuring out how is that behind the scenes system operating. That first scan that I've got here, that is literally measuring that fight or flight response, the gas pedal, survival and stress, versus a more calm, wellness and regulated nervous system. If we're in survival mode, you can absolutely expect that there's going to be way more struggles and way more challenges and healing on top of that. So the scans are really paramount. That's step one. And then as we go throughout care, we're going to do those scan updates to make sure we're seeing change, make sure there's a positive trend in that whole process, and we're addressing those underlying neurological issues. Parents, last advice here is please share this. There are so many families that when we're sitting down, we're having these conversations, they're a year, they're 5 years into their healing journey, they're decades into it, and they're saying, oh my gosh, I wish I would have known this sooner. I wish I would have known to start with the nervous system. I wish somebody would have told me when my kid had this severe birth trauma that I need to go backwards and address that first. You can help us, right? Please share this video, send them to an upcoming event we have, right? If you're listening to this here as we post it, just in a couple days here, Saturday, March 22nd, we've got a Raising Healthy Kids Naturally workshop. We're gonna dig into how the nervous system is at the root of everything else. And we're even gonna touch on some of those other things, right? There's gonna be an integrative functional medicine pediatrician here with me, Dr. Haley from Abundant Life. Because we love these other approaches, right? We love those other aspects of holistic and natural health when it's done right, when it's done in a way that's really gonna get that kid result. So please share this video if you think you got someone in your life that could benefit from it. We'd love your help spreading the word and making a bigger impact on families.